I'm here to let you know that you are useless, sad, and powerless. You are no one, and your presence will amount to nothing. I will suck the vitality and inspiration out of you until you no longer want to get out of bed in the morning. I am depression. I am also here to make you a nervous wreck every time you step outside. No, step outside your door. Every social interaction you have, I will be there, making your mind race, making you jump to conclusions. If you make one small mistake, I will blow it completely out of proportion for years to come. Sometimes, for no reason at all, I will be there just for my convenience, making you worry about absolutely nothing. I am friends with depression. I am anxiety. According to Psychology Today, over 15.7 million Americans are struggling with depression in many forms: seasonal, bipolar disorder, postpartum, etc. It's not uncommon for someone with depression to also have an anxiety disorder, and although they have similar symptoms, they are not the same. If you were to ask me a few years ago what depression and anxiety were, I wouldn't be able to answer. Growing up, I had always felt that there was something wrong with me. Every time I would talk to somebody who wasn't a close friend or a family member, I would ruminate on everything that I said, how I could have said it better, the different ways it could have gone, and everything in between. If I stuttered during a conversation, for example, I would think about it for days, weeks, even months after it ended. Among the compulsiveness, I also noticed myself losing interest in most if not all of my hobbies. Doing even the most basic of things was a struggle for me, and I could never find out why until I started going to therapy my freshman year of college. According to several sources, depression is a common mental disorder. Having anxiety can lead to depression diagnosis. The two go hand in hand in most instances. First, I will discuss what depression is and what can lead to it. Depression is a condition in which a person feels hopeless, unmotivated, and just generally discouraged with life. It can ruin your sleep schedule, disrupt your appetite, cause weight gain or weight loss, and strain relationships. It can happen at any age, but it often happens in teens and young adults. Mostly found in college students, depression can stop them from going to their classes, not completing assignments, fail their courses, and just generally not get out of bed most days. Depression is different from the fluctuations in mood that we all experience as a part of normal and healthy life. Temporary emotional responses to the challenges of everyday life do not constitute depression. The severity of these symptoms depends on what a person have or is currently going through, such as the death of a loved one, trauma, genetics, injuries, drug abuse, etc. Now, if these symptoms seem or sound familiar, they are associated with anxiety as well. An anxiety disorder may make you feel anxious most of the time without any apparent reason, or the anxious feelings may be so uncomfortable that to avoid them you may stop some everyday activities. Anxiety disorders are some of the most common psychiatric illnesses affecting children and adults. Over 40 million Americans suffer from this disorder. When fear starts to have control over your life and starts to interfere excessively, it turns into a disorder. Anxiety, along with depression, is another common mental disorder. A variety of anxieties include phobias, panic disorder, social anxiety, OCD, and GAD, which is generalized anxiety disorder. It is normal for someone with one anxiety disorder to have another disorder. Anxiety disorders are additionally much of the time joined by depression or substance abuse. Anxiety disorders can exist with physical well-being conditions also. In such cases, these physical conditions should be dealt with. Now that I have discussed about them individually, it is time to talk about them together. There is no conclusive explanation as to why anxiety and depression are so often coexist, according to the Anxiety and Depression Association of America, but you can find relief from both with the right treatment. Depression and anxiety issues are distinctive, yet individuals with depression frequently encounter indications like those of anxiety issues, for example, apprehension, fractiousness, and issues resting and thinking. People with anxiety can spend most of their lives in a distressed state, and depression can set in soon after. No one knows why they go together, but there is a treatment for both of them. Being both anxious and depressed is a challenge. Clinicians have watched when anxiety happens together with depression. The indications of both depression and anxiety are more seriously contrasted with each other compared to when the disorders happen alone. In addition, the symptoms of depression take more time to determine, making the ailment more unending and more impervious to treatment. No one has to suffer from anxiety disorder or depression, and certainly not both. People with anxiety disorder should speak to a psychiatrist, therapist, or other healthcare professional about their symptoms and start treatment before depression has a chance to set in. As someone who has been diagnosed with depression and anxiety, I know firsthand the effect that they can have. Though the two normally go together, depression and anxiety have different symptoms but can share some as well. And although I haven't found that light at the end of the tunnel yet, I know that it will inevitably get better for myself and anyone who has been diagnosed with these disorders. Thank you.